is AI actually going to make us or force us to be better, right? As the people seeing patients.
That's a
What I
good
mean,
question.
what I mean by that is if information is so easily accessible, it's going to make patients come in way smarter, right? Way more than the WebMD Google era of
Sure.
patients accessing information, and they're going to come in with things that are like lit review sourced and stuff like that. And so
Yeah.
now it's forcing us to be smarter and have to actually understand a lot more to answer each individual patient case and the nuances. And so I think that it may make us better doctors or forces us to all be better doctors in order to be better at the explainability part of what an AI spits out. And then have those nuanced conversations of, okay, here's how you did this search. Based on my learning, let's talk through all of this information you gathered.
Welcome to another episode of the HealthCast, where we explore the intersection of healthcare, technology, and business development with a focus on improving patient outcomes. My name is Phil Zappone. I'm a family nurse practitioner in Southwest Colorado, and I'm the CEO of NXAI Growth Consultancy. Today's guest is a pediatrician and CEO of Grapevyne, a digital platform focused on physician autonomy and empowerment. In this conversation, we'll explore Dr. Chan's career journey as a provider and entrepreneur and dive into his mission and discuss insights into the future of healthcare and technology. Dr. Chan, welcome. Thanks so much for coming on the HealthCast.
Thanks so much for having me, Phil. I'm excited for the conversation.
All right. Let's dive right into it. In order to lead towards Grapevyne, what healthcare problem are you most passionate about solving right now?
That's a great question. For me, with Grapevyne specifically, it's the problem with workforce development and our overall ability to have autonomy and build a career with intention. I think a lot of physicians go through pre-med medical school training, become an attending, and always just like have this one route that's set up, not really seeing or having blinders on about the rest of the healthcare ecosystem. And we all have other interests in humanities, in tech, in business, in research, and public health. And so I'm trying to create this platform to allow basically a third space to have those conversations, because it's hard to have them while you're at work. And the current infrastructure to allow us to have these opportunities, whether it's networking or just to have a conversation about some of these other interests, only happen in very, very expensive in-person conferences that happen maybe once or twice a year. So I'm trying to provide a much more accessible space for physicians to access professional development and networking in order for us to have more autonomy and more intention with our work. I will want to add, though, that the other area of passion of mine, maybe even more so than what I'm doing with Grapevyne, is just the entire landscape of children's health. I think there's a lot of fragmented care in pediatrics. One of my biggest motivations of trying to go in or wanting to go into entrepreneurship when I was in residency was actually to solve some of the issues on overall pediatric access to care rather than be at that micro level of individual patients. So a big passion area of mine is children's health and overall pediatric care.
Love that. Why is this moment in healthcare such a critical opportunity for innovation?
Huge question. Well, right now, the most obvious thing when I even hear the word innovation in healthcare, I think of AI, right? It's completely transforming the landscape from everything on our back end when it comes to the administrative work to patients having more direct to consumer access or, I guess, like free access to a lot of health information. And it's creating this sort of paradigm shift where, in my opinion, well, let me rephrase that. Oftentimes the conversation is around, is AI going to replace us? Or is AI going to make us, be something that like is an added tool to us? I think one thing I don't hear as much is AI actually going to make us or force us to be better, right? As the people seeing patients.
That's a good question.
What I mean by that is if information is so easily accessible, it's going to make patients come in way smarter, right? Way more than the WebMD Google era of
Sure.
patients accessing information, and they're going to come in with things that are like lit review sourced and stuff like that. And so now it's forcing us to be smarter and have to actually understand a lot more to answer each individual patient case and the nuances. And so I think that it may make us better doctors or forces us to all be better doctors in order to be better at the explainability part of what an AI spits out. And then have those nuanced conversations of, okay, here's how you did this search. Based on my learning, let's talk through all of this information you gathered. So I think it's a huge I don't know if I answered your question head on, but in terms of like the importance of innovation, I think it's very important for us to catch up with this current AI boom and transformation of healthcare and essentially be better doctors, be better communicators with our patients.
I'm hearing continuing to adapt too.
Yeah.
Maybe initially, I initially had some resistance. I was intimidated. Now, AI is a tool I use, but and also I've been in those shoes where patients are presenting more educated, more knowledgeable. Where do we
Yeah.
go from here? It can be a lot to take on.
Yeah. I've if it's okay for me to go through a story, like a really quick story. I myself, like there were some questions I had regarding infectious disease and some test results that was questionably like, is this latent TB? Is this a false positive? And there was a difference between what I was getting from open evidence and what I was getting from like an ID doc. And I'm like, so who do I go with? Right? Like the ID doctor, the ID specialist, like he was one person. Open evidence is doing a lit search for me right in the palm of my hands.
Yeah.
Do I trust that or do I trust the doctor? And ultimately, like we kind of talked through things and we landed on the same page. And it was like, let's start treatment and things like that for latent TB. But it was just like the fact that that moment even happened is the sort of revolution, that transformation that's happening in the industry right now. It's like, what's your trusted source? And so I think it's putting a pressure cooker on the physicians to be better, like I said earlier.
Let's take a step back for a minute, and I want to hear a little bit more about your career journey as a pediatrician
Yeah.
and business developer.
Yeah,
Or
yeah, yeah. I never saw myself in the business world. I always went through that traditional tunnel I referenced earlier of
yeah,
going, I wanted to be a doctor because I want to help people. Started going through pre-med, med school, etc.
was that an ambition from a young age?
That was pretty, yeah, I was pretty young. I remember the earliest memory I have of it was a pulmonologist came in for career day and I created this like construction paper brochure of what a pulmonologist does. And that was my earliest memory. That was, I think, second grade. Yeah.
Yeah.
So, and my parents were more than happy that I dreamed of becoming a doctor. They had no issues with that.
Are they physicians?
No, 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 no. I'm actually first generation college student, first generation U.S. immigrant. I
Heck
was born
yeah.
in China, came to the U.S. when I was one with my mom, and yeah, first physician in the family too.
That's a
Yeah.
long journey. Awesome. That's great.
Yeah. So, going through med school, I did take a year off to get an MBA in health management and policy. It was a great opportunity to kind of land it on my lap. And that just taught me the lay of the land about health econ, health policy, health law, everything else that goes into this system that unfortunately in med school and in other like nursing school, like we don't learn that aspect of things, right? And so it gave me a little bit of a seed for understanding that, hey, there's so much else going on that impacts patient health and population health. Fast forward into residency, I was intending to go into pediatric hematology oncology, but as I went through, I started working on more quality improvement projects, advocacy projects, and I really enjoyed that work. Like I derived a sense of fulfillment from that work that alongside the disillusionment of what we were doing during my work hours as a resident of like I just felt like I was putting band-aids on situations. Hospital door was a revolving one. People come in nonstop. Many cases felt like they could have been dealt with upstream or prevented from getting to this point. And in order to work on those issues, you think as a doctor or as an NP, like, okay, well then primary care needs to get better. Well, then on the outpatient side, on the primary care side, oftentimes I felt like I was just box checking. And when a patient actually brought up a problem during their annual visit, one problem or two problems, my entire schedule got thrown off. I could not actually work on these issues in that moment without cutting 40 minutes or so into the next appointment. And then now you have patients complaining in the waiting room, like, what's going on? Why am I not being
Snowballs.
seen? Exactly. And sometimes these issues, it's not a, hey, let's follow up in 2 weeks, let's follow up in 3 months. It's something we got to deal with now, right? And to at least talk through. So that also didn't feel right. And then so I'm like, what's upstream from primary care? Systems level, healthcare policy, fixing how the workflows are, fixing our insurance system, all these other things that put pressure on how we work. And so that's the motivation of me going, I learned a lot in the MBA year. I'm not satisfied by the clinical work I'm doing because I don't feel like I'm helping people the way I grew up. I thought I was going to grow up to do. And what is everybody else doing in industry? So I started networking. I started asking for networking connections at every call I had. And I just learned how is everybody playing a role in this massive $4 trillion industry in our country. And I then got into a like unpaid internship, venture capital fund building opportunity, overlap with the last month of my residency. I decided to essentially create my own entrepreneurial fellowship while my colleagues and friends were doing their 3-year fellowships after pediatrics, after the Gen Peds residency. And then that's how I kind of caught the itch of wanting to build something on my own. That's how Grapevine started, and what kind of went through that typical startup founder cycle of going through pivots, having to deal with a lot of different stakeholders with different interests that may be sometimes pulling in different directions. We did a lot of business development. I've learned that I really enjoy strategic partnership creation. I love community engagement. I love having calls just like this that we're having today. I like selling. I mean, sometimes it sucks because like obviously you never want a negative result, but like I like the aspect of, trying to convince someone that, hey, this is gonna solve a pain point, right?
Mhm.
And yeah, that's how I kind of landed in the business side of things. And so now what's actually really, really interesting is I am going to start a new opportunity soon. I think, yeah, my start date's in May, and it's going to be in a pediatric primary care setting, but I'm going to work in both the clinical operations side as well as practice clinically, and it's in pediatrics. So I've like come out and did this fellowship of entrepreneurship, and now I'm rehoning all the skills, both clinically and non-clinically, back into children's health. So I'm really excited about that opportunity, and I'll continue building Grapevine and supporting physician professional development and autonomy like as a passion project.
Yeah. You're a busy dude. Let me see if I can break that down. Continuing with Grapevine, I like that passion project. That's great. And then primary care physician duties as a pediatrician, and then some
Yeah,
admin
yeah,
behind the
yeah.
scenes work is what you're saying there,
Exactly. It'll be
and using
a
your business skills.
it'll be a medical director role, so overseeing a couple different clinics that are here in the DC, Maryland, Virginia area.
Do you have a I wanna dive further into Grapevine, but I wanted to learn a little bit more about you first. Do you
Sure.
have a personal a mission, a personal purpose that maybe overlaps with your work?
Yeah, yeah, yeah. It always sounds weird when I say it out loud, but it's like I want to fix pediatric healthcare. Like I want to make sure that I work in an emergency room setting right now, part time, and I want to see the emergency room be used less as a primary care source. I want to see individuals, regardless of their income status, be able to access healthcare the way everybody accesses healthcare. Or let's put it this way, I want there to be better equity between the individuals that just are low income and relying on Medicaid or don't even have insurance because they just moved to the country or something like that, have an equal opportunity or an equal footing to get healthcare that, especially in pediatrics, you want to set them up for success for the rest of their life. You don't have anything about opportunity of economic success or career fulfillment if you don't have your health. I want to see that equity play out a little bit better in pediatrics. I want to see pediatric practitioners, the NPs, the physicians, everybody in children's health get paid better. I want there to be Medicaid parity. I want there to be a better system so that more medical students are actually motivated to take on pediatrics as their career choice and not choose only anesthesiology, dermatology, ophthalmology because they're making literally a factor of 10 greater than we are, right?
Yeah.
So I think I think it's just like, I'm not saying that these gaps shouldn't exist or anything like that, but I think the gap has become too wide. And so that has caused a lot of systems level issues that I just want to work on. And if that can translate into the greater healthcare ecosystem, then I'll be great too. But I think life sort of what's giving me meaning in life right now is helping kids access healthcare systems better, helping families improve their healthcare literacy, and then making sure that doctors and everybody that's seeing patients on the front line is developing a fulfilling, satisfying career and not getting burnt out the way that we are right now.
Yeah. I love your energy, and I'm hearing your passion. Can you we touch upon again, like, what drew you specifically to pediatrics? I get
Mm,
the care provider and
yeah.
the drive to become a doctor, but yeah, specifically pediatrics.
I love this question because I just love answering this question. I went into medical school thinking I wanted to do neurology. And when I was going through rotations, what I quickly realized was it didn't matter which specialty in terms of like a medical focus it was in. I liked it all. Like I kind of just enjoyed the pathophysiology, the anatomy of every subject. Even surgery, like I wasn't keen on surgical workforce culture, but I liked the OR and I liked being hands on. I've always been a very hands on person. And when in the non-surgical specialty rotations, I enjoyed the procedures the most. I love, doing all like any type of procedure. But what I loved the most, or when I was most enthusiastic about getting up and getting to my day-to-day responsibilities, was when I was in pediatrics on that rotation, shadowing in those clinics. And it kind of clicked too because I like did a little retrospective, like kind of self-assessment, and I was like, huh, I've always just enjoyed being in like after school programs, did summer camps,
Personally.
daycare programs. Yeah, that was just like all my
And
volunteer.
I didn't know if you meant as like say a teenage job or teenage coach, or but personally also you enjoyed that stage of development.
Right, exactly. And
Yeah.
I also felt, like I say that I'm a kid at heart. I'm like basically a child in an adult body, and I feel like I can connect with teenagers and younger children in ways, right? Like that are just not to be a humble brag, but like better than some of my colleagues did. And in medical school,
Sure.
oftentimes you hear like, why wouldn't you do peds, right? Like you ask medical students, like, why not? Why wouldn't you want to choose pediatrics? Answers typically range from I can't deal with parents to I can't deal with like a patient who literally can't tell me what their problem is, right? Or I can't deal with like the drama or whatever. And nowadays you have the payment issue has been an issue. Nowadays you have politics involved in the mix. And so it's a very challenging field with a lot of reasons to not do it. And for me, all of those reasons was just more reason to do it because I think someone needs to fight the fight. I think these kids very literally do not have a voice for themselves. They can't vote. They literally sometimes can't talk. So someone needs to be an advocate for them. And I just enjoy that aspect. And I love teaching. And so the whole aspect of like working with parents, even the ones that are the most combative with you, I derive so much fulfillment from having that conversation and landing on the same page with a parent who started off in disagreement with me. So that's why I chose pediatrics.
That's a fantastic answer.
Yeah.
Sounds like you're in the right place. Good for
Yeah.
you.
Yeah.
Sounds like we need more providers like you. Take us through. Let's talk about Grapevine. I've tried to explore it to some degree, and it feels like there's some different things that it offers. There's a lot there. Take us through some of the big things that it has for its users.
Sure. So what Grapevine is, the sort of one-liner, uh, because everybody is aware of this other company. Like I say, it's like I'm building something that I thought a company like Doximity would have built a long time ago. And what I mean by that is like Doximity is supposed to be like the LinkedIn for physicians, right? And Ps and PAs. And they became more focused on like their clinical support tools, and some of these other little tools and things like that. And then after they IPO'd, I think they're just like they have financial incentives that they have to focus on. It never became that like engaging platform where if I needed to find a mentor, if I needed to learn a little bit about what private practice versus academia is from an actual conversation with someone that's in it, like it wasn't the best for that. And so as I was going through my personal career journey, I felt like I had to navigate a lot of this by myself, especially as a first gen college student and a first gen physician in my family. And that's essentially what Grapevine is boiled down. It's a space to provide it's a space for everybody to have those conversations that you don't have time or an ability to really have at work, right? On all the non-clinical interests that you might have, on research, on QI, on advocacy, on public health, on tech, on everything. And it's also a more accessible, free community to join so that you have access to educational webinars, in-person networking events that don't cost you like $750 annually for a membership. And then you have to get CME coverage to go get hotel travel to that
Yeah,
one city
right.
once a year, right?
Yeah.
Only if you can have that time. So I'm really trying to build I would say like high touch, very, very engaged community for medical professionals to access professional development resources and networking. And my tagline is empower physician autonomy. And when I say autonomy there, it's not, I think oftentimes online, physician autonomy is directly translated to like stay in private practice. That's not necessarily what I mean by autonomy. I just mean be intentional about your career. Make sure you're building a career that you truly want to, right? Not just get swept away by the tunnel in the process and then end up sometime mid-career or late mid-career going, I think I want to try something else, or there's other interests I have. I don't know where to turn or how to even do that process. Learn all that proactively. It's preventative medicine for your career is how I think of it. So Grapevine's providing all of that.
Like an antidote to autopilot.
Yeah,
Yeah.
exactly.
Yeah. I like it. Let's ask questions about business and so forth. I think that it walks the line of both your medical career and Grapevine as well. How do you measure success these days? Whether it's patient outcomes, operational efficiency, what does success mean to you?
Yeah. So right now, because I haven't started that kind of clinical operational opportunity that would be starting in about 2 months, I think of success with Grapevine, and I think of it with the direct feedback I get from the community members. When I have an event and someone says, "Hey, I learned something today," or when I host a webinar and I see there are 25 attendees, and each time I host one, there's more RSVPs to it. Right? That metric to me is success because it's saying what I'm actually delivering is valuable to somebody. And sometimes that could just be one person, right? I've had webinars where only 3 people showed up. One person of those 3 messaged me afterward and said, "Hey, after that, I reached out to one of your guests and we have a call scheduled next week." Boom, that's success for me. So
Yeah.
that's how I measure success there because I think it's providing exactly that proactive, preventative, intentional career building that I sought out to do with this community.
What milestones or achievements are you most proud of? Stump.
Yeah, you did. I think sometimes I just don't see them as milestones, but they objectively are, right? Like graduating medical school, matching into residency, graduating residency. Those are clear-cut milestones that I would be dumb to not say I'm not proud of them. But I think what I'm most proud of is having the courage to make that decision to leap into something that is a complete black box to me, meaning making that leap in residency and that choice to say, I'm going to go try something in this business world that I have no business trying to like do because was not an undergrad business major or anything like that. My MBA was focused on health management and policy, and I have no actual boots on the ground experience building companies or anything like that. So taking that leap and really when the opportunities landed, taking advantage of them, they may not be milestones, quote unquote, but they are probably the things I'm most proud of because I'm glad I took that leap of faith or that risk. And even like, for example, with Grapevine, it having to pivot from the original idea. And oftentimes in startups, when you have to pivot, it may feel like it was a failure of that initial idea. It was more just a learning opportunity. It was more of now I'm doing something else. And it like that pivot is, or that mistake or that failure, quote unquote, is the reason for what Grapevine is today. It's the reason now I'm opening up myself to an opportunity that is back into children's health, which I'm also very passionate about. And so I'm very proud of my mistakes as well, if that makes sense.
Heard something that makes sense. It definitely makes sense. I heard something the other day that made an impact on me that there's only winning and learning.
Hmm.
So I would tread lightly when you say mistakes. I mean, it's how we grow.
Yeah, I 100% agree with that.
What are some of the biggest obstacles you're facing today?
Biggest obstacles.
Whether it's in the clinical setting
Yeah.
or getting the word out or
Yeah. For Grapevine, it's getting the word out. Like if I had to take it from a like biz dev standpoint, it's like getting the word out. But at the same time, I'm not going down the road of like trying to pay for marketing or do search engine optimization. I'm not trying to do that. I actually really like the word of mouth spread of Grapevine and individuals telling their friends like, "Hey, just met this guy. Did a little digging on the website. I think it could be helpful to you." And like I've had friends that are non-clinicians. Like I have actually just yesterday, I had 2 lawyer friends who they're like, "Hey, we have a buddy that's a doctor that's kind of burnt out and wants just to like learn a little bit about what other roles are out there. Can I connect him with you? I know you're building something with Grapevine." I mean, going back to the metrics of success question, like that's another metric of success for me, right? Is like, and I like that organic growth. A little bit of an obstacle of just like getting the word out there quickly and growing the membership quickly, but it's okay. I think I'm okay with that. I think the other obstacle, just from a career standpoint for me, I have met and now gained so many people that I consider mentors that I am so lucky to be able to just text and ask questions about because I'm doing something so non-conventional with my career. But for those, it still is an obstacle sometimes trying to explain my motivations and how I'm going about it to the physicians that are still in that traditional route. And I wish it was a little bit easier to explain. In residency, I'll tell you this. One of the kind of like last straw on the camel's back that broke the camel's back of making this decision to take a leap was an attending who told me when I was trying to get a patient, like just improve the workflow to get a patient out of the ER because we were super busy, that I'm a doctor, I need to focus on doctoring. And I'm like, what does that even mean? And like I think I am doing doctoring, right? Like there's a Scrubs episode recently, actually in the reboot, where one of the residents was concerned that like the patient's not getting their medications because their insurance isn't covering it. And so he wanted to call the insurance company and go through all this stuff. And then JD, who's now, spoiler alert, JD, who's now like the chief of the hospital, a chief of internal medicine, tells him, "Hey, we have a lot of patients to see. Like, that's the job. And he later on in the episode apologizes for that because he realizes that wasn't the right thing to say to a mentee and to an intern. He understands that like this person it was from a good place that he wanted to do what he was doing. I didn't have that apology moment. I didn't have that like attending who then self-reflected on that moment and realized that I was actually trying to help a patient through working on quote unquote not the doctoring part. And it's hard because I think there are a lot of traditionalists in the physician profession that still kind of stick with that and might even agree with that advice that I just vehemently disagree with. And so that's a little bit of a personal obstacle or philosophical obstacle that I have.
Where do you see Grapevine in the next 3 to 5 years?
I want to see at least 1,000 members in there. I'm like near 500. I want to see 1,000. I want to see 2,000 members in there. I want to see autonomous conversations happen. I want to see engagement happen. And I see that happening because I think you just need the numbers sometimes. I see it as the platform where obviously there's a lot of like different Facebook groups and communities out there, but I do see it as the place where in 3 to 5 years, where if a medical student or resident, an NPPA, a doctor, a practicing doctor goes, I feel a little bit stuck or I'm a little bit confused about a certain part of my professional growth, they will have someone next to them that was like, hey, you should go check out Grapevine. Um, I'm pretty bullish on that happening in 3 to 5 years.
You may have touched upon this, but I'm gonna wrap up with these last two questions for us. What long-term impact are you hoping to create?
On the children's health side, I'm hoping that there will be better access and less fragmented care through the new opportunity that I will be entering, especially in this regional and local area that I'm in. I hope there will be easier access for the patients that we're seeing and that we will be able to prevent them from needing to get sicker, prevent them from needing to use things like the emergency room as their primary care source. That's what I hope on that end. On the Grapevine end, the impact, I think I alluded to this earlier or throughout this entire conversation. It's having people in the medical profession going through that process have something that is a reliable resource to help them through making career decisions.
What motivates you to continue innovating in healthcare?
It's just a very important space, right? Like without health, there is no opportunity. There's no upward mobility. There's nothing, right? And health is something that obviously impacts everybody. Nobody out there wants to be unhealthy. So whether it's innovation that can slowly nudge or incentivize people to take charge of their health, to lead healthier lives, or it's me individually seeing a patient and one-on-one trying to help them stay healthy, lead healthier lives, that's the motivating piece because it affects everybody in the world, and with good health comes everything else.
We'll close it out there.
Yeah.
Dr. Chan, thanks so much for coming on today. Really impressed with the work that you do, with the efforts with Grapevine. I wish you continued success, and thank you for spending some time with us on the HealthCast.
Absolutely. Phil, thank you so much for having me.
You bet. Stay tuned for another episode of the HealthCast. Thanks for joining us. See you guys.
Bye, guys.